We really believe that remission should be the goal in patients with rheumatoid arthritis because we know that this results in better long-term outcomes for the patients. They have better quality of life, they're able to go back to work or keep working, and they also can improve some of the physical function difficulties that an RA patient might have, and it allows them to have a normal life working or maybe even just enjoying the activities of daily living with their family. So we really believe that the goal is to be able to offer therapies that can get, hopefully, each and every patient to remission. What we've learned about rheumatoid arthritis is that the inflammatory process that happens in the body of a patient with RA really involves the different immune cells, anywhere from the T cells, the B cells, the macrophages. We also know that these cells speak to each other using inflammatory cytokine signaling. That's why in the past, successful class of medications that are currently being used in RA are blocking these inflammatory cytokines, such as TNF and IL-6. More recently, a new class of drugs have come up called the JAK inhibitors. This time, what the target is a kinase that is involved in the intracellular signaling, which is a pathway that is used by many different inflammatory cytokines when they attach to the cell. One of the medications that AbbVie is currently working on is called upadacitinib, which is a selective JAK1 inhibitor that, again, is involved in the inflammatory intracellular signaling in patients with RA. We know that for most of the inflammatory cytokines, they typically signal through the JAK1, whereas the JAK2 are typically involved in more physiologic processes like hematopoiesis, and therefore you want to minimize the impact on the JAK2 to minimize the impact on things like the hemoglobin, which might cause anemia. You also want to minimize the impact on JAK3, which is typically involved more in fighting infections. So that's why a selective JAK1, it's not specific, it's selective, can potentially be effective in patients with rheumatoid arthritis with less impact on the JAK2 and JAK3 effects. I think the treatment of rheumatoid arthritis would continue to be tailored to the individual patient needs. We know for a fact that every RA patient is different. The presentation of their disease is very different, and that each patient might need a different treatment in order to get to a low disease activity or remission state. And so the availability of different treatment options with different mechanisms of actions really gives more patients the opportunity to achieve their treatment goals. One of the novel approaches that AbbVie is doing right now is understanding if combining medications that target two different molecules would actually be effective and safe in rheumatoid arthritis. We currently have in our pipeline AbbVie-599, which is a combination of a JAK and a BTK inhibitor that's currently in phase 2 in rheumatoid arthritis. So AbbVie Immunology is very much focused in elevating the standard of care, not just in rheumatology, but also in dermatology and gastroenterology. Part of the work we do is also not just bringing new medicines for the diseases that we have worked on when we were working on Humira, but we're also looking at other diseases for which, for example, our selective JAK1 inhibitor might be effective and safe. For example, in dermatology, we're currently in phase 3 in atopic dermatitis, and we just recently started a giant cell arteritis program in rheumatology.